what causes sleep apnea, there's multiple factors. Adiposity is one driver that changes the volumetric size of someone's airway. But if someone has a smaller airway to begin with, whether that's a deviated nasal septum, enlarged turbinates, small like craniofacial anatomy, that person too, who is not obese, who might be a mouth breather or may have some anatomical obstruction, can also have obstructive sleep apnea. And the interesting thing is, different sexes in different age groups present differently with symptoms of this quote unquote sleep apnea syndrome. So it gets missed often. And when we see this frequently in clinic.
Dr. Chopra, thank you so much for joining me today. We're going to be talking about sleep apnea, longitudinal testing, and so much more. As we get started, can you tell our audience about your background and what you do?
Yeah, absolutely. First of all, please call me Sahil. I think we should just keep it very informal. I'm a pulmonary critical care internal medicine sleep physician. Did IM at UCLA, did pulm crit at Loma Linda. In between, I worked as a hospitalist for about 3 years. And during my pulm crit fellowship, became really interested in sleep and ended up doing a sleep medicine fellowship. And luckily, I matched at the same program you were at in Boston. And how we were looking at sleep was very holistic and comprehensive, and it was ingrained into our heads that sleep testing, looking at like as a sleep doctor, your job is to understand the physiology of someone during this window of sleep. You're not a sleep apnea doctor. Your job is to understand what happens to someone's brain physiology, cardiovascular physiology, pulmonary physiology during this window of sleep. And after I finished fellowship, there was like really no opportunity that let me practice sleep medicine that way. So we started Empower Sleep.
So we'll get into what you guys do at Empower Sleep because I think it's really exciting. I refer patients to you guys all the time because it is different and what you have to offer. So we'll put a pin on that and come back to that in a few minutes. Maybe we can start with talking about just a little bit about sleep apnea. I know in the medical community, there's sometimes a myth that only overweight patients who snore can have sleep apnea. Now, I hear this from my colleagues where I might recommend that their patient get a sleep study and they'll say, oh, well, they don't have sleep apnea, they're not overweight, or they don't snore. So could you speak about that and maybe debunk that myth?
Absolutely. And if someone is obese and they're a male and they have a big neck and they have hypertension, the positive predictive value of having sleep apnea is much higher. But that does not mean young, thin men or women, or even children for that matter, cannot have sleep apnea. And it's if we look at what causes sleep apnea, there's multiple factors. Adiposity is one driver that changes the volumetric size of someone's airway. But if someone has a smaller airway to begin with, whether that's a deviated nasal septum, enlarged turbinates, small like craniofacial anatomy, that person too, who is not obese, who might be a mouth breather or may have some anatomical obstruction, can also have obstructive sleep apnea. And the interesting thing is, different sexes in different age groups present differently with symptoms of this sleep apnea syndrome. So it gets missed often. And when we see this frequently in clinic.
That's really helpful. Yeah, I see this a lot with my patients. I mostly see patients for psychiatric issues, so depression, anxiety, and then insomnia is kind of what I focus on in my practice. And we screen for sleep apnea and we pick it up all the time in those sort of non-standard or not the archetype of what we're all taught to look for. So could you elaborate a bit more on who are some of those patients that might be getting missed with regard to sleep apnea? In other words, for the primary care doctor, the psychiatrist who's listening, what should they be looking out for in patients who don't fit the mold of the overweight male with the 17-inch neck?
I think there's a couple of things, and I'm sure you've talked about this with this community as well, but the way that I've been thinking of this is basic information from a history of do you have any symptoms of sleep onset issues, sleep maintenance issues, or do you just wake up not rested? If someone consistently wakes up not rested, something is really pathologic there. I think there's like a lot to unpack. And I think if I had to pick one question, like how do you feel when you wake up on a consistent basis? And if they consistently say that I don't feel rested, like something is wrong with their sleep that is resulting in them feeling that way in the morning. The other thing that is more of, I'll just sort of bucket it into like this idea of signs rather than symptoms, is do they have a consequence or a comorbid condition that is like closely tied to sleep disorder breathing or sleep apnea, such as AFib, refractory hypertension, cognitive impairment, prediabetes or refractory diabetes, or some higher than expected cortisol levels. I like looking, identifying those, or hypogonadism, for example, like anything that disrupts the function of sleep, or when the function of sleep is interrupted or disrupted, there will be downstream consequences as a byproduct of that. And if you have any of those consequences, then I think that's also a reason to at least go back and look at someone's sleep.
And that's a wide net, right? A lot of people fit into those categories.
And I completely forgot like mental health issues. Like if someone has chronic anxiety, or they have depression that is sort of refractory, or if they're on a stimulant during the day and they're on a sedative at nighttime, I think these are all, once you see it, it becomes really easy to identify these patterns. But these are all, I think, clues to go back and look for a possible sleep disorder.
Yeah, that's exactly right. You mentioned that sleep apnea can present differently in different patient populations. And I'll just share what I see a lot in my practice is so I see a lot of women with anxiety, with depression, with chronic aches and pains, almost a fibromyalgia like picture. And it's not really improving with standard treatments. And in the past few months, actually, I sent a bunch of them to you guys for testing. And I think four of the women that I sent in the past few months all had moderate to severe sleep apnea. And they had been working with other doctors and trying different sleeping pills. And then they were referred to me because their insomnia wasn't improving. And then we did the testing. So, a take home for anyone who's listening, have a low threshold for testing. And so I think this is a good segue to talk about the testing that you offer at Empower Sleep. Can you talk a bit about what that looks like and what's involved? And then we can talk about longitudinal testing as well.
Yeah, absolutely. We're using off the shelf home sleep testing devices that are clinical grade, FDA approved, that are backed by hundreds of peer-reviewed articles. One of those is one of these sensors that just goes on your finger. It's a little ring-based device. And there's a few other ones that we use too. Some go on the chin, some are more comprehensive. But the idea is like taking these different tools for they can be used to understand someone's physiology during sleep and then using them across time so that one can understand what is happening to this person's sleep on a night to night basis. So the sensors that we use are not proprietary to us, but we've just built the ability so patients can do them across multiple nights, as well as the interface so patients can see their results every morning when they wake up. So traditionally, what would have happened is one would have to go to a lab, they would go do a sleep study, or they may even do a home study, but then that sleep study has to go to a sleep doctor in the cloud who will then sign off on it on their convenience. We just automated that process to take the sleep doctor kind of out of the picture. So patients are sort of empowered with their own sleep data every morning.
It's a really powerful process too, because in the app that you have at Empower Sleep, patients can log their data. They can log if they took supplements, if they took medications, how they felt. And so you don't get all of that information with conventional sleep study. So even as a referring clinician, it's really cool for me to be able to see that information and then we can correlate treatment and see how they're responding to different interventions.
Totally. And like one of the things that I get really excited about is, hey, you had this one night with really good sleep. Like, what did you do? And like sort of reverse engineering. Like, what did that person do from what time they woke up, what kind of activity they had, what kind of foods did they eat, what time did they go to bed, what time did they have dinner, presence or absence of alcohol, and try to reverse engineer them to have sleep like that on a consistent, reproducible basis. And in a traditional model, we kind of can do this with these consumer grade wearable devices. But in the situation of sleep apnea, it's that becomes sort of next to impossible to do because the metrics that we're measuring for sleep apnea, they're not available in most of the consumer grade tools.
Okay, that's a great point because this question comes up a lot with regard to the Apple Watch now having sleep apnea screening or Aura Ring, which I use just for personal use. So, what's the utility of those consumer grade wearables? Should we be looking at that data as clinicians, especially for the non-sleep clinician? How useful is it? And then what exactly is the sleep image device that you're using for sleep apnea testing? What is that measuring that you can't get on a consumer grade wearable? As you can see, there's a lot to learn when it comes to clinical sleep medicine, and we're just scratching the surface in today's interview. If you are a physician or a health practitioner who wants to learn more about clinical sleep medicine in a practical way that you can use in your everyday clinical work, then get my free sleep mini course. I'll put the link to that in the video description below. You can also get it at intrabalance.com/doctors.
First of all, I think these consumer grade devices are phenomenal at highlighting, allowing the patient or client or the user to understand their physiology over a 24-hour period. I think that's so powerful. And it allows them to start to understand some basic trends. If someone has consistent symptoms of a sleep disorder with poor quality sleep from a wearable device, that person should end up with a sleep study at some point. And so then the question becomes, well, how is a sleep study different? One is the diagnostic accuracy and precision of these devices. And that all sort of goes back to the idea or the fact that consumer grade devices sample data at a much lower frequency. And to detect something like an apnea, we define this in sleep medicine as a cessation in breathing that is 10 seconds or more. These consumer grade devices don't sample data at that frequency to be able to identify mild apnea or moderate apnea. But these medical grade devices that sample data continuously, like almost 100 times a second, they give us a very rich signal, a high resolution signal of what is happening to breathing, what is happening to heart rate. And as a byproduct of that, you can identify so many more things. It's kind of like the idea of a CT scan being done for lung cancer screening. Like the volumetric samples of each of those slices is much larger, so that you can sometimes miss smaller things. So sorry, let me rephrase. Like in a high resolution CT, like the volumetric slices are much smaller. So if you're looking for like tiny micronodules, because the slices are so much smaller, you can miss things in between. And similarly, like comparing a consumer grade device to a medical grade device, you can miss subtle apneas, heart rate spikes, if on these consumer grade devices that you can very easily identify on a medical grade device. So it samples data much better. It helps identify apnea, and then it gives you all these additional metrics around how fragmented is this person's sleep? What's the objective quality of their sleep? How much movement are they having during the night? So it gives us much more information about what's happening to someone's physiology during this window of sleep.
That's really helpful. And I'm also thinking about if someone's referring their patient for this longitudinal testing. So, question one is how many nights of testing can you do? And how does that differ from the traditional model of sleep testing? And then the second question is so you can detect obstructive apneas. What else can you determine from the results? Like, can you detect other types of sleep disorders?
To answer your first question, we in a traditional model, one might end up with 1 night or 2 nights of testing max. And that's good. It's something is better than nothing. But what we'll typically do is just start off with a 7 to 14 day baseline. And during this 7 to 14 day baseline, have them journal what they're doing throughout the day, what they're doing at nighttime. So now you really have an understanding of what is this person's sort of night to night variation like from a sleep health standpoint, and what influences that variation in what kind of way. So that's kind of like the a good starting point for assessing someone's sleep health upfront. And your second question was, I forgot.
Yes, so the second question is, can you detect other sleep disorders using the sleep image device?
You can detect central sleep apnea, you can detect obstructive sleep apnea, you can detect how fragmented their sleep is. Although that's not sleep fragmentation is not truly a disorder, but it's a very powerful biomarker to understand how many sort of micro arousals is one having during sleep. So in someone who has insomnia, for example, if they have if you have someone who has insomnia but with low sleep fragmentation, that person can do very well with modalities like CBTI versus someone who has insomnia symptoms but with very high sleep fragmentation. That person might need a sedative or a hypnotic or something to increase like one's parasympathetic tone during sleep. And so it helps us better risk stratify insomnia with these additional biomarkers that are available. It helps us discern between central apnea, obstructive apnea, and also the different and also risk stratify that population. It allows us to indirectly understand restlessness during sleep. And sometimes this restlessness is correlated with restless leg syndrome. So although it's not like a direct marker, indirectly we can start to get some clues of could this person have RLS type of symptomatology. And the other thing is, again, this is a little bit indirect, but when you have multiple nights of data, you can start to identify circadian rhythm issues like this. You can see this natural oscillation in sleep timing and wake up timing across 2 weeks, and it can allow one to identify where is there, what kind of a chronotype are they from a sleep wake circadian standpoint. So it gives us a ton of information, both directly as well as indirectly.
Right. Yeah, no, I found it so useful with my patients, just, one for diagnostic purposes, but also for tracking and for getting additional insights. Okay, so let's say the clinician refers the patient to you, they get tested. Now they have a diagnosis of obstructive sleep apnea. What's the next step?
Yeah, that's kind of a can of worms because I think that's one of the myths is like sleep apnea equals a CPAP machine. And that's not the case anymore because now you can sort of experiment with different things to see what helps one mitigate the burden of apnea and improve their quality of sleep. And this, the way that, okay, I'll take a step back and just share how we think about this. We try to quantify someone's sleep apnea based on how much fragmentation of sleep do they have. So I'll take even a further step back. Traditionally, sleep apnea is defined by some level of symptoms and them having more than 5 pauses in breathing per hour, and that's it. But into this very simplistic equation, we can now add what's the quality of their sleep, how much apnea do they have, how many desaturations do they have, are those desaturations long, are they short, are they positional, are they during REM sleep, are they during non-REM sleep? And this whole idea is called endotyping. Like what are like these tiny characteristics of someone's sleep apnea that can help me understand or conclude that this person will do better with this kind of a modality versus another one. Okay. And it's more comprehensive and beyond the idea is this mild, moderate, or severe sleep apnea. And so let's say you have someone who has severe hypoxic obstructive sleep apnea and they're obese. In that person, a CPAP type of a positive airway pressure device is probably going to be one of the better solutions. But let's say you have someone who has no other sleep disorder like insomnia, restless legs, and they have sleep apnea, snoring that is mild, non-hypoxic. They're a mouth breather. They have chronic nasal congestion. In that person, I would basically start off with nasal steroids, nasal lavages, nasal strips, help them retrain themselves to breathe better through their nose and avoid supine sleep, sleeping more on their side, and then see what happens. And what we've learned is about 30% of people who have mild apnea, who have decent sleep quality to begin with, their sleep apnea can be managed. Actually, they don't need a CPAP machine, neither do they need a dental appliance. Just these off-the-shelf solutions can objectively and subjectively make their sleep better. And then you have a whole bunch of things in between, like dental appliances, myofunctional therapy, that is kind of like physical therapy for the tongue. And you have what are called EPAP type of solutions, where EPAP stands for expiratory positive airway pressure, where you can breathe well, breathe in without any kind of resistance. And when you exhale, there's a little bit of resistance, and that resistance helps create a little bit of back pressure in the upper airway. And this is like, these are really good solutions for someone who is non-obese, is maybe a middle-aged postmenopausal woman who might have mild apnea with depression. And CPAP is the treatment of CPAP is worse than the disease. And you want something that is sort of tailored to this individual, solves the problem, and is not linked to all these hoses and all these other sort of cumbersome things that come with having to use a CPAP. So we try to figure out what's the problem, what's the symptoms, what are the goals, and find a solution that fits that, but then also fixes the problem for that individual. And then for other people, surgeries are always an option. Seeing an ENT doctor to improve nasal breathing if there's any kind of a mechanical obstruction. Inspire, which is an implantable hypoglossal nerve stimulator. Mandibular advancement devices are, they can be great solutions. So there's like a really big toolkit of solutions available for people who have obstructive sleep apnea. And I want to say north of 95% of people, we should be able to find them a solution that objectively and subjectively solves their problem.
Yeah, it's really incredible because this is truly personalized care and it is tailored to each individual. And there's lots of options. And in the traditional model, someone will either have a diagnosis of sleep apnea or they don't. And then it's maybe categorized into mild, moderate, severe. And then they're offered CPAP or an oral appliance, maybe surgery, and that's it. So I just wanted to emphasize that for anyone listening, just to know that this is a cutting edge treatment approach. I haven't seen this offered anywhere else. So I'm curious, where do you see the future of sleep medicine going? Things are evolving so rapidly. So what are you most excited about, and where do you see things going in the next few years?
I'm really excited about this whole AI movement that is happening in, I think, all fields of medicine. In sleep medicine, I think it's even more exciting because the bar for sleep medicine was quite low to begin with, and unfortunately, and so with AI, there's going to be this like massive jump in how we can think of sleep care for individuals. And I think a couple of things are going to happen. One is there's going to be understanding of sleep pathology at scale. And like I'm a big believer that similar to how a decade ago we kind of knew that most humans will have a mobile phone. Now I think it's like 7 billion people have a mobile phone. I'm also a believer that about a decade from now, a majority of the world will have a wearable device. And most of those wearable devices will have some kind of a PPG based signal. And PPG based signal is like that red light or that green light that's on the back of the watch or is inside of the ring. And these sensors are phenomenal. They PPG photoplethysmography can be used to understand blood pressure, understand blood glucose, understand sleep, and there's going to be a whole bunch of other new signals that can be derived from this raw signal. So there's going to be this understanding of health at scale over the next decade. There's going to be diagnoses at scale over the next decade. And I think there's going to be like organizations that can build tools that are AI based that provide end of one care at scale, helping providers do that in like helping them see insights that they would not be able to see otherwise, or they will provide care to 80% of humans without the need of a provider or a clinician, or and only those who really need the help of a doctor will get their help. So I think there's going to be access to really good care for so many more people over the next decade. And I think our technology that the AI-based technologies in all of the sectors of healthcare, especially in sleep, I think are going to open that up.
Yeah, it's just amazing to see how things have changed so quickly, even just over the past couple of years. And so many of our patients now are using these wearables. So I think even just learning as a doctor, learning how to use those in practice is it's important for us as doctors to keep up with these trends because yeah, things are just moving so fast. So what advice do you have to the non-sleep doctor who wants to provide better sleep care, more comprehensive sleep care in their practice, but they're really busy? The average primary care doctor only has a few minutes with each patient. So what advice do you have?
Yeah, that's it's a tough situation to be in. And being an internist myself, like I understand how I had my own PCB clinic when I was in residency, and you don't have enough time, and your time is competing for diabetes and hypertension and other complex conditions versus sleep. And I think if you have the time, just having the conversation, I think there would be two things. One is a quick check-in of how are you sleeping? If you're not sleeping well, if you have the time, try to probe a little bit further. And I would encourage everyone to at least do a sleep study. It's similar to if I go to a physician and say I don't breathe well, they won't typically give me an inhaler. They'll like at least auscultate me, get a better story, and they may order a chest X-ray or an echo or a CT angio or something because symptoms work up treatment, right? That's kind of our framework. And unfortunately, in sleep medicine, it's symptoms and treatment. I would encourage all PCPs to at least do some kind of a workup or anybody to do some kind of a workup. And that in sleep medicine is a sleep study, and sleep studies are so easy to do nowadays. It's a ring-based device. It could be done anywhere, either in a local sleep lab, or you can even buy them online for a one night sleep study for $150. And so please, I would encourage everyone to do a sleep study. And the second thing I would encourage everyone to do is before prescribing a sedative or a hypnotic, I think a sleep study is a wise investment because these sedatives, hypnotics, they can be addictive. They can result in downstream consequences in the wrong individual, whether that's osteoporosis or falls or cognitive impairment. And that list goes, it's a very long list. And before doing that, especially if it's being done chronically, doing a sleep study is it's extremely formative because there might be something else that is being masked with this sedative or hypnotic on top.
That's such great advice. And I see this time and again in my practice where patients have cycled through multiple types of hypnotics with their doctor, and then they're referred to me for treatment-resistant insomnia. And then it turns out there's a sleep disordered breathing issue or something else going on that wasn't detected. I wanted to go back to the sleep apnea testing piece because something I hear a lot from my colleagues is that it takes too long to get their patients into sleep clinic for testing. Some sleep clinics have a wait list of like 6 months, or they just don't know where to send their patient. So you mentioned that it's a lot easier these days to get sleep testing done. What are some resources, whether it's Empower Sleep or other resources where doctors can refer their patients?
Totally. If you just want to buy a sleep study, you can even go to like lofta.com and patients can buy a sleep study for it's like $160 or $180. It's a one night sleep test. They need a prescription, they'll ship it out in a couple of days, I would imagine. And at least it's something. If they won't necessarily meet with a doctor, but at least they'll get some kind of a report. If you just Google sleep study, there's going to be probably 10 Google ads that you'll come across, and all of them you are using usually the same sensor. There's not that many different sleep testing tools that everyone uses. Some are single night, some are multi-night. I think it just comes down to what's the goal of the patient. If the patient is looking for just a quick and easy diagnosis, then something like Lofta or Dream or any of those things could be economical solutions where $180 and you can get things done probably within a week. But then if you have someone who has a problem or is looking for more comprehensive care, then seeing a sleep doctor, I think, is important, either locally or online, like whatever fits your needs. And if they want to see Empower Sleep, we would love for the opportunity to provide very personalized care to them.
How does it work at Empower Sleep? It's fully virtual and you can see patients in all states, or can you tell us how it works?
It's virtual. We provide our services to patients across all 50 states. Patients are typically referred to us. They'll typically do a comprehensive consultation with one of our doctors to really understand from a sleep, daytime routine, evening routine, medical history standpoint, circadian history standpoint, what all is going on. And then we'll start off with usually a 7 to 14 night sleep study using these ring-based devices to understand what's the baseline health of their sleep. And then depending on what we find, we'll continue to take care of them over the period of time. All of the care coordination that we do, patients can text their doctor. We have a sleep coach on the team, and so sleep coaching visits are free for all patients that are active members of Empower Sleep. Patients can do unlimited nights of testing. We use this data to help personalize their care. And what I'm really excited about is uh, our clinicians, like our Empower Sleep platform is open to all of the doctors that we collaborate with. So there is full visibility. So like when you refer a patient out to say a local sleep lab, that referral goes into a black box and you don't really know what's going on. So we've been very intentional about making sure that we can update our referring doctors with automated consultation notes via email, letting them know that, hey, your patient has started sleep testing. These are the results. Your patient even has a visit on this day, and here's a Zoom link, and you are welcome to join if you want to. We've designed this in a way so it's hyper collaborative. So everyone is on the same page. Patients know they're being very well taken care of, and there's full visibility into how we're taking care of patients.
It's such a great system, and my patients have loved it, the patients that I've referred. And it's great because, like you said, normally if you're referring a patient out for a sleep study, you're waiting weeks to get that report back. And with Empower Sleep, when I refer my patients for a sleep study, they'll ask me, "Did you get the results yet?" I'm like, "No, I don't need to wait for the results. I can just log into the portal right now and we can look at the data together." So it's just, yeah, just such a modern approach to testing and treatment. So, as we wind up here, is there any message that you'd like to leave our audience with today?
It's probably something that you have already emphasized in all of the amazing content that you make, but sleep is a foundational component of our health. And if your life will just be better if you sleep better. And I think I'll just leave it there because it, good sleep amplifies everything in a positive way or in a positive way, and bad sleep de-amplifies everything in a negative way. So if someone's sleep is good and you can help them get there, everything that you do will be so much more leveraged. So would just invite you to having the conversation about sleep with your patients, looking at it in a more objectified way. If you think there is a problem with some kind of testing through anybody, and then addressing that problem will then, over the next one third of however much life they have, because if we sleep a third of our life, their life will just be better over time.
Excellent. Well, thank you so much, Sahil, for your time and sharing your expertise today. I'll put all of the links to Empower Sleep and the other resources that you mentioned in the video description below. So for you, the listener, if you want to check out some of those links, just go to the video description underneath this video. And thank you again, Sahil. I really appreciate your time and for coming on the channel.
Nikki, you're a rock star. Thank you. Thanks for having us, and looking forward to all the amazing content and information that you're sharing with all of the doctors out there.